Hi, I'm Dr. Lane Smith. Welcome to the Plastic Surgery Channel.
Hi, I'm Dr. Bill Adams, and welcome to the Plastic Surgery Channel's newest show, PSC Hot Topics, where the channel's experts weigh in on current hot topics in plastic surgery and help you cut through the hype and myths in plastic surgery. With me today via webcam is Dr. James Namnoon. Jim, great to have you with us.
Great to be here, Bill.
So there was a recent article that just came out in the New York Times last week, and it was about awake breast augmentation, where breast augmentation is performed with the patient not under anesthesia, or I should say under local anesthesia. And I wanted to get your thoughts about that for the next minute or so. So tell us a little bit about that. The thinking is that, at least what's been professed, is that this is a safer way to do breast augmentation. Give us your thoughts.
Well, I think that the question is, what is safety? We all know that most breast augmentation is done very safely, obviously, and effectively under general anesthesia. This is breast surgery that's done by quite experienced surgeons. As we know, the risk of general anesthesia in a healthy patient is significantly less than the risk of driving to the grocery store. So I think the first idea or concept that it's somehow safer to do it under local is really probably false. Secondly, I'd say that surgery under local anesthesia is, if anything, much more difficult than surgery under general anesthesia, and consequently, one would want an extremely experienced surgeon to consider, if one was going to consider doing surgery under local anesthesia, as their surgeon. Unfortunately, the article contends that with basically a weekend course, perhaps over soft drinks, and in a 30-minute teaching seminar, one can learn everything you need to know to do this kind of surgery under local anesthesia. So I think safety is really not what's paramount for these doctors, and certainly not in the best interest of the patients.
So what about the what's been touted as an advantage of this technique is that patients, because they're awake, can actually participate in selecting the size of their breast implant. Is that realistic?
Well, Bill, it's a great idea. Unfortunately, it's not very realistic. I mean, the patients have to be sedated using the same kind of drug, I'm sure, that Michael Jackson got to help him go to sleep during the regular nights. And that drug is, if anything, a profoundly sedating medicine. So as a consequence, the patients really can't play any role in making any decisions about their surgery because they're not going to be able to remember any of it. So it's hard to imagine that someone who's that quote-unquote drugged can really play a rational, make a rational decision about the size or shape of their implants. So I think that's really not correct. That assumption is really not true at all.
And lastly, just do you feel, is this a good concept for patients?
No, not at all. Frankly, patients really don't know beyond a certain level what's safe and effective for them to help them get the best result. We certainly like to involve them in the decision making, but careful planning and precise execution are the keys to avoiding reoperation in breast augmentation. As we all know, even in the best hands, the reoperative rate is anywhere from 20 to 30% at 6 years. So as a consequence, these are operations that are not to be considered as trivial operations. Doing them well requires a lot of planning and really excellent operative execution, not something to be done casually.
I think those are really great words of advice, and certainly going to a board-certified plastic surgeon would be the first step in somebody considering a breast augmentation.